Welcome to my lesson, Rock Solid, a lesson in bone health. Today you will gain a better understanding of the foundation of our body's strength and stability. Just as a sturdy building requires a solid framework, our bodies rely on healthy bones to support us through every movement, from the simplest gesture to the most rigorous activity. How much do you actually know about your bones? Do you know what makes up your bones? The hardness of your bones comes from calcium and phosphate salts, and about 35% of our bone is collagen, which is protein, which gives them their flexibility. Bones are fluid and not firm. They are flexible and they move all the time, and they are constantly broken down and being built back up, which makes them stronger. Did you know that people slowly begin to lose their bone mass by the age of 40? Have you ever heard of osteopenia or osteoporosis? Osteopenia is a condition of low bone density, and osteoporosis is a condition of porous and thin bones. But osteoporosis is not so much the problem as what is called fragility fractures. So what is a fragility fracture? A fragility fracture is considered a low energy trauma, such as a fall from standing height or even less. And it is a sign of the underlying condition of osteoporosis. Let's look at the history of bone health for a minute. In 1984, the U.S. Health Conference decided that bone fractures were a health problem and decided to increase calcium intake. However, fracture rates have not declined. They have continued to increase. The U.S. calcium recommendation started at 600 milligrams a day. But because that amount did not decrease the amount of fractures, the recommendation increased to 800 milligrams, then 1,000 milligrams, and then to 1,200 milligrams a day. The part that doesn't make sense is the fact that countries where people consume less than 360 milligrams of calcium a day rarely have fractures. So what do we need to increase to prevent fractures? We need to increase collagen because collagen equals flexibility. Let's talk for a minute about calcium and dairy. Conventional dairy contains a lot of calcium, but it is not in a form that is easy to digest and absorb. It is a difficult food for most women to digest and assimilate and causes many hormonal issues. Conventional dairy is contaminated with growth hormones, antibiotics, and cows are fed genetically modified corn, which causes inflammation in their bodies, which goes into the cow's milk. Conventional dairy has been linked to cancer, heart disease, allergies, ear infections, sinus problems, irritable bowel syndrome, and lactose intolerance. The Harvard Nurses Health Study followed more than 75,000 women for 12 years. And the study showed no protective effect of increased milk consumption on fracture risk. In fact, increased intake of calcium from dairy products was associated with a higher fracture risk. A website you may be interested in is switchforgood.org. If you would like to break free from conventional dairy, a much better option as a replacement for traditional dairy is raw dairy, which I covered in detail in a different lesson. Raw dairy is excellent for improving the quality of your bones. Now let's talk about bone density drugs. First of all, our body keeps 99% of our calcium for our bones and teeth, and our body must maintain 1% calcium in our blood to keep a proper pH level. The body will break down the bone to replenish the most critical 1% calcium that is needed in the bloodstream. Bone density drugs can interfere with this process because they disrupt the normal bone regeneration process, making bones more brittle and prone to fractures. Tests may indicate increased bone density, but the bones are not stronger. And we also have to consider the result of excess calcium supplementation by people with low bone density. A Journal of American Medicine research study found that taking vitamin D and calcium supplements did not protect against fractures in people over 50. Other studies have indicated that increasing daily calcium supplementation may increase your risk of heart disease, kidney stones, gallstones, osteoarthritis, hypothyroidism, obesity, and type 2 diabetes. Unless calcium supplements are from a whole food source, the body has a difficult time utilizing them and may deposit calcium where it shouldn't be. For example, they have found that 90% of the plaque buildup in arteries has been calcified, which is what hardens the arteries. So if excess calcium supplementation is a problem, where is the best place to get your calcium? Think about it. Where do the largest boned animals in the world, like giraffes, elephants, and cows, get their calcium? They get their calcium from the greens that they eat. So let's talk about what contributes to increased bone loss. I don't think this will be a surprise to you. What contributes to all disease contributes to bone loss. Processed foods, including white bread, pasta, chips, and foods containing wheat, have been shown to interfere with our ability to absorb vitamins and minerals. And I can't leave out sugary foods such as cereals, muffins, cakes, and cookies, and low-fat foods, which are void of healthy fats that are needed to absorb fat-soluble vitamins like vitamin A, vitamin D, vitamin E, and vitamin K. Coffee and soda contribute, and sadly, caffeine leaches calcium from our bones. And lastly, medications including antacids with aluminum, steroids, acetaminophen, blood pressure medication, and diuretics, which are used to expel water and salt from the body, also contribute to bone loss, as well as lifestyle choices like consuming alcohol and smoking. So what are some things that you can do to strengthen your bones? You can eat leafy green vegetables and include healthy fats for better absorption of the nutrients of those greens. By doing this, you will be giving yourself a good boost of calcium, vitamin K, potassium, and other minerals and nutrients that you'll need to rebuild your bones. Make sure you eat protein from naturally raised animals and sustainably sourced fish. The protein helps make collagen for your bones so that they have flexibility. Eat some organic whole grains because they provide magnesium, which is necessary to help deposit the calcium into your bones. Eat nuts and seeds as they provide trace minerals necessary for the formation of your bones, but remember to soak the nuts and seeds to aid your digestion. It is also a good idea to use bone broth in your cooking and even drink it. Bone broth contains valuable minerals in the form that your body can easily absorb and use, including calcium, magnesium, phosphorus, silicon, glucosamine, and a variety of trace minerals. It is also important to consume a generous amount of good quality fats. The quality fats optimize the absorption of your vitamins, which are necessary for healthy bones. Make sure you get enough sunlight. 30 to 40 minutes every day is ideal because the sun offers you the very best usable source of vitamin D. And although vitamin D is referred to as a vitamin, it is actually a multifunctional hormone that is vital for many processes in the body. In relationship to bone health, it is essential for pulling calcium out of the bone and into the bloodstream to maintain the 1% critical that your blood needs for pH balance. Calcium and phosphorus are both necessary minerals for bone health, and vitamin D plays a role in the balance of the two. Your intestines stimulate both calcium and phosphorus absorption to increase your serum levels of these minerals. Vitamin D stimulates the reabsorption of calcium and phosphorus from your kidneys, which reduces the amount that you lose in your urine. The growth of your bones also depends on vitamin D. It plays a role in shuttling calcium out of your blood and back into your bones for remineralization. So make sure to take the time in your day to soak in some sun. Also make sure you drink plenty of water. Water helps keep the bones hydrated so that they are more flexible. And make sure you're doing a few forms of regular exercise. It is beneficial to walk, climb stairs, and especially lift weights to strengthen your bones. you will want to include some type of activity that works against gravity. And lastly, make sure you get enough sleep because your body heals and repairs while it is sleeping. Your bones provide structure, protection, and mobility. By adopting these habits that prioritize bone health, you can safeguard your skeletal integrity and preserve your quality of life. And here's the great news. You can put on bone mass at any age, so do everything you can to maximize the potential of your bone density and maximize the potential of your overall health.